Hello, my name is Dr. Ann Wells. This presentation is about preparing for the dental admissions test, otherwise known as the DAT. The DAT is a standardized test administered by the American Dental Association, the ADA, that is required for admission to all U.S. dental schools. The best resource about the DAT is the ADA's website, ADEA.org, where you can download the 2013 program guide to the DAT. Just a quick note, during the application process, you're going to deal with two different entities. You will register for the DAT through the American Dental Association's website. And most of you will apply to dental school through ADEA AADSAS, the centralized application service administered by the American Dental Education Association, otherwise known as ADEA. You can learn about ADEA AADSAS at ADEA's website, ADEA.org. The DAT is a half-day test of your knowledge and skills in 4 content areas. Natural sciences, which includes biology, general chemistry, and organic chemistry. Reading comprehension, which involves reading short passages on scientific topics and your ability to read, comprehend, and analyze basic scientific information. Prior understanding of the topics of the passages is not required to answer the questions posed. Quantitative reasoning involves algebra, numeric calculations, conversions, probability and statistics, geometry, and trigonometry. The perceptual ability test, sometimes known as the PAT, is probably unlike any other standardized test you've taken. The test is composed of 6 subtests: apertures, view recognition, angle discrimination, paper folding, cube counting, and 3D form development. Because the DAT assesses cognitive skills, preparation for the test is important, especially for the perceptual ability test. Becoming familiar with sample test questions and preparing yourself for the pace of testing is strongly recommended. A few quick facts about the DAT. You can register for the DAT up to 3 times, but must wait 90 days to retest. I strongly encourage you to be prepared to take and be successful with the DAT the first time you take it. The current cost of the DAT is $385. Aim to take the test only 1 time, but know that you can retake it if your scores are not what you want them to be. After registering for the DAT, you will receive an email notification from the ADA to contact a Prometric testing center and schedule a date to take the DAT. Unlike many other standardized tests, there are no prearranged or single test dates. You may select the date you wish to take the test. However, the date must be within 6 months of the date of your registration. Many students ask how old their test scores can be. While the majority of students take the DAT immediately prior to the year of application to dental school, some students delay their application. Generally, most dental schools will honor DAT scores that are up to 2 years old. The DAT scoring range is 1 to 30. You will receive scores in the following areas. First, an academic average, which is a composite of all the subtests, excluding the perceptual ability test. Second, you will receive a perceptual ability test score. Third, you will receive a total science score, which includes biology, general chemistry, and organic chemistry. And then you'll receive breakout individual scores in each of the sections of biology, general chemistry, and organic chemistry. The average scores reported here are the average scores of all test takers last year. If you do not have these scores, does it mean that you won't be eligible for admissions to dental school? Certainly not. Remember that these are averages and that there are many applicants with higher and lower scores who are admitted to dental school and are successful in their studies. Here's how your DAT scores are reported. First, as you leave the Prometric Testing Center, you will be provided with an unofficial score report. Keep in mind that these scores are unofficial. After receiving your test scores, the American Dental Association verifies your scores and then makes official DAT scores available to the dental schools you've selected through their own web portal. And if you selected at least one ADEA AADSAS participating dental school, your scores will be transmitted to ADEA AADSAS for inclusion in your application to dental schools. The process of verifying and transmitting your official scores can take 3 to 4 weeks. Probably the #1 question I receive is how best to prepare for the DAT. And there's a pretty straightforward answer. Practice, practice, practice. I consider that there are 2 aspects of test preparation. First, reviewing and becoming familiar with the test content. And second, practice taking tests in a timed format. The ADA offers both an online tutorial as well as written and online practice tests. Check ADEA.org for more information. We do not recommend or endorse any commercial test preparation products, but you might want to check with your health professions advisor or other students about any commercial products that were helpful to them. Another important question a lot of students ask is, when is the best time to take the DAT? The simple answer is when you feel you're well prepared to take the test and in consideration to the timing of your application. Back when I was an admissions dean at a dental school, I encouraged students to consider taking the DAT shortly after having completed their organic chemistry courses, as organic is the highest level course tested by the DAT and therefore probably the best time when content is fresh. Again, I want to discourage you not to walk into the DAT cold. That is, taking the DAT for the first time as a diagnostic to determine your strengths and weaknesses in preparation for a retake. Be ready to do well on the DAT the first time you take it. Also keep in mind that many dental schools will not seriously review your application until they've received your DAT scores, so don't delay your DAT unnecessarily late in the application process. Many of your friends who may be applying to medical school may be talking to you about changes to the MCAT, the medical school admissions test, and you may be wondering if similar changes are planned for the DAT. The answer is yes and no. For the foreseeable future, the DAT will remain in its current format. However, the quantitative reasoning section of the test is being redesigned, and it's anticipated that the new format will be released in 2015. The new quantitative reasoning test, starting in 2015, will feature the elimination of numerical calculations, conversion, geometry, and trigonometry, and will also feature the addition of data analysis, data interpretation, data sufficiency, quantitative comparison, and more critical thinking items in probability and statistics. Updates about this change will be made available on the ADA website as they become available. As I conclude this presentation, I want to remind you that admission to dental school is about more than doing well on the DAT. Most dental schools now utilize a holistic review process to screen and select applicants to interview for admission to dental school. Not only does this involve a review of your GPAs and DAT scores, but also your experiences and personal attributes. Keep in mind that to be considered a well-qualified applicant to dental school, admissions deans, directors, and committees want students who have the potential to be successful academically, and also those who possess qualities and experiences to become successful oral health practitioners. The bottom line is it's more than just about grades and test scores. On that note, I conclude this presentation with a reminder that the DAT program guide and the ADEA.org website are 2 great places to get answers to your questions about the DAT. Thank you, and good luck with your preparations.